Welcome back. We're now going to begin on part 2 of the introduction. We will now move on to concepts related to pathophysiology and the disease process. So we have physiology and pathology, whereas physiology is in regards to functions of the human body, and pathology is the study of structural and functional changes in the cells, tissues, and organs that cause or are caused by disease. Putting physiology and pathology together, we have pathophysiology. We will take a look at the following components that are listed here: the cellular and organ changes that occur with disease, the effects of these changes on various body functions, the mechanism of the disease process, and healthcare measures and practices in order to treat or manage these disease processes. Mostly with this course, we will be focusing on the pharmacotherapy related to these disease processes. So why do we need to know this information? Diseases are not one-dimensional. As a nurse, you'll be presented with a lot of information and we'll have to decipher it, put together the pieces of the puzzle, essentially. Ultimately, you have to understand these processes rather than memorize. That is where understanding the underlying concepts will be important and then applying them to specific exemplars. We will discuss that more later in the presentation. A disease is defined as an acute or chronic illness that causes physiologic dysfunction. Each disease is going to have specific characteristics, specific signs, symptoms, and etiology, prognosis, etc. We will take a look at the following information here for each one of our disease processes: the etiology, the pathogenesis, the morphology, clinical manifestations, diagnosis, and the clinical course. As you move forward in your courses, you will learn about the nursing interventions that are going to be associated with these diseases. But here, like I mentioned before, we will primarily be focusing on the pathology and the pharmacology associated with each disease process. So etiology is the cause of a particular disease or the trigger. Mostly when we talk about etiologies or triggers, we want to talk about modifiable and non-modifiable risk factors. A modifiable risk factor is something that we can change. A non-modifiable risk factor is something that we cannot change. So if we take a look at the particular causes here that are listed, which one of these would be modifiable? Which one of these would be non-modifiable? Think about that a little bit. So most definitely, genetics is something that is going to be something that is considered non-modifiable. Age, gender, ethnicity, those would be considered non-modifiable. Something that may be considered modifiable: lifestyle, intake of chemical agents such as alcohol, obesity, diet, high-risk lifestyles. So these are all something to think about when looking at the etiologies and triggers. Pathogenesis is the mechanism by which the disease develops, progresses, and either persists or resolves. So why do we need to know that? We need to know this, we need to know about pathogenesis in order to learn and develop prevention methods and ultimately improve patient outcomes. Morphology involves the cellular and tissue changes that occur in response to inflammation, aging, and the disease process. Here we look at the underlying or fundamental structure of tissues and cells, microscopic changes that may be characteristic of a specific disease process within those cells and tissues. So this involves histology, or the study of cells or the makeup of body tissues. And this is typically done, most commonly you will see when diagnosing cancer. A biopsy, when looked at underneath the microscope, looks at the changes that are present within those cells and biopsy tissues and matches them up with the particular known characteristics of the disease process. Clinical manifestations, or signs and symptoms, are the evidence of the disease. So here we should understand the difference between sign and symptom. Really, it's a subjective versus an objective finding. A sign is the effect of a health problem that can be observed by someone else. A symptom is an effect noted and experienced only by the person who has that condition. The key difference, really, between signs and symptoms is who observes the effect. The significance of these signs and symptoms is that they help lead us to a diagnosis. So think of that nursing process: assessment, diagnosing, planning, implementing, and then evaluating. Evaluating or looking at these clinical manifestations, these signs and symptoms, is part of your assessment. Those assessment findings lead you to your diagnosis and thus help the progression of the nursing process move along. Occasionally here we see the term compensatory mechanisms. Occasionally you may also see compensatory mechanisms where the body is engaging in a self-protective mechanism to maintain homeostasis. An example of this would be an increased heart rate with blood loss, or changes in arterial blood gases with certain types of disease processes that we will see in later classes. Essentially here with these compensatory mechanisms, the body is trying to maintain a state of equilibrium. Some additional items to note when discussing clinical manifestations are syndromes. Syndromes are a compilation of signs and symptoms. Here we have a couple of examples. So one particular example would be fetal alcohol syndrome. And the signs and symptoms that you see noted here are those that are particularly characteristic to that particular syndrome. Complications, these are adverse outcomes from a disease or outcomes from a treatment. Here we have that broken down specifically. Tuberculosis may be a result of HIV infection. Due to the body being immunocompromised, they are going to be more susceptible to those types of disease processes or infections. And the use of corticosteroids in treating certain conditions can ultimately lead to elevated blood sugars. It can lead to mood changes. It can lead to weight gain. So those would be some adverse outcomes either from a disease process or from treatment mechanisms. Sequelae are typically a chronic condition that is caused by an acute disease state. For example, a traumatic brain injury may lead to memory or personality changes, and a strep infection may lead to rheumatic fever. This could also be related to stroke. A patient may have aphasia following a stroke. Moving on to diagnosis. So part of that diagnosis is the assessment. We use all of that information from our assessment findings in order to come up with a diagnosis. We have to think about a little deeper into the assessment finding, not just focusing on those clinical manifestation portions, but getting a history of the patient. What is their chief complaint? What is the history of present illness? What is the review of symptoms? What is their past medical history? What is their family history? What is their psychiatric and social history? A physical assessment as well. And then we need to compare this also to diagnostic testing. So a diagnostic testing would be lab results, a chest x-ray, a CAT scan, an EKG. So we create a diagnosis based on our history from the patient, our physical assessment from the patient, and then we would confirm that or create a differential diagnosis and or validate it with those diagnostic tests, putting it all together. Like we mentioned before, putting the pieces of that puzzle together. With each diagnosis, there will be a specific clinical course or evolution as to how the disease may progress. Diseases may be acute or they may be chronic. So looking at some examples of these, what do you think? An acute disease state is generally going to be self-limiting, and it typically is going to resolve within 3 to 6 months. Whereas a chronic condition is continuous, it is long-term. You may have times when the disease is in remission, or you may have exacerbation of that disease. So an acute could be an infection. It could be a urinary tract infection. It could be a bone fracture. Chronic may be pain, COPD, renal failure, congestive heart failure. Something that involves exacerbations or remissions, it could be Crohn's disease, ulcerative colitis, congestive heart failure, like we mentioned before. We may also take a look at the spectrum of diseases. We can see this with the stages of HIV and AIDS, and also with certain types of cancer. There are 3 levels under the spectrum. First, you have your preclinical, subclinical, and then clinical. Preclinical, the disease isn't evident, but that patient still has the potential for transmitting that disease process. In subclinical, the disease still is not evident, but it may be detected before it becomes clinically evident with those signs and symptoms. Here you may use screening tests to evaluate. Clinical, here you have those signs and symptoms that are fully present. It's important to also take a look at the epidemiology of the disease, or the study of the occurrence of the disease process. Think of infectious diseases, perhaps tuberculosis, one that is still around today, but due to research and understanding, there have been public health initiatives to control this disease. What about polio, something that used to be around but is no longer seen? Maybe Ebola, which we saw a few years back. Perhaps we could even consider something as new as the COVID-19 pandemic. So why do we need to know this? Why do we need to study the occurrence of disease within a population? Why do we need to look for patterns of the disease in regards to patient's age, gender, lifestyle, geographic location? Well, the purpose here really is to determine how the disease is spread, how to control it, prevent it, and ultimately eliminate it. So we need this research done. We need to create these public health initiatives so that we do not have pandemics, outbreaks, public health concerns in the future, or we can eradicate or control the spread of such. In addition, we also want to look at these terms when looking at patterns of disease. All of this information is data-driven. It is the basis for those public health initiatives. Those public health initiatives that are aimed at promoting and optimizing the health of populations. We want to take a look at the incidence, the prevalence, morbidity, and mortality. All of this information helps us create these effective public health initiatives to help ensure population health and growth.